Joining me now is Dr. Peter McCullough, a fan favorite. Dr. McCullough, good to see you.
Good to see you. Congratulations on your baby, and you look terrific. I followed you social media the whole time.
Oh, thank you so much. I really appreciate that. It's hard to believe she's already 6 months old, but here we are. Dr. McCullough, let me ask you this. You were right about the COVID vaccine. You got a lot of flack from your peers in the medical community when you were saying, wait a second, this vaccine is an experimental technology. It's not safe. It's not effective. The Public Health Administration is gaslighting you. My question now, fast forwarding to the couple of year mark that we're almost at 21, 22, 3 years into it. How many people do you think, either in our country or globally, how many people do you think died and or were injured or are disabled from that vaccine?
Vaccines are taken as religion in medicine for hundreds of years now. They're accepted based on faith, and that's how the COVID vaccines were accepted. They had, only 3 months of data. No one knew if they were going to be safe or if they would work. They were widely accepted by the medical community in a sense as vaccine ideology or a religious belief. Some people think they're like a talisman, that if you take any vaccine, it protects you. In this case, what we found out that the COVID vaccines have led to record injuries, disabilities, and deaths. Our CDC, as of September of this year, has certified 19,027 Americans have died of the vaccine in U.S. territories, and about 1,150 die in the vaccine center or later that day. Another 1,200 die the following day. That number is underestimated, it's believed, by 30 in FDA testimony. So that would put U.S. casualties from the vaccine at 570,000 Americans. And then worldwide, Dennis Rancourt, epidemiologist from Montreal, has the worldwide numbers by summer of 2023 at a total of 17 million. So these are catastrophic medical deaths due to COVID-19 vaccine.
It's appalling to even try to quantify that number in my mind when I hear you say this. Tell me a little bit about how you came to be as prominent as you are as a dissenting voice, because it's my understanding that you weren't always what they call red-pilled on medicine. I mean, you're the most published cardiologist in the United States, an absolutely prestigious, impressive career. What about COVID or how the Public Health Administration were treating vaccines and lockdowns was that wake-up moment for you?
Well, to clarify, I study the interface between heart and kidney disease, and in that area, I am the most published cardiologist in the world on that topic. There are a few cardiologists still alive who've published more papers, traditional cardiovascular papers. And I testified in the Congressional Oversight Panel in 2007 on a heart-kidney issue. I've lectured at every major university in the United States. I was the named visiting professor at Harvard in 2019 in both cardiology and nephrology. So I was widely known. But during the pandemic, by invitation, I was invited by The Hill, a Washington journal, to write a series of op-eds. Scott Atlas from Stanford was asked as well. Scott focused on masks and lockdowns. I was focusing on how the virus was spreading, how people were getting sick, and how to treat it early to prevent hospitalizations and deaths. So I published an op-ed in August of 2020, and the title of that op-ed was The Great Gamble of the COVID-19 Vaccine Development Program. I'm the only public figure in the world in writing who questioned the vaccines before they came out. The only one I can find.
Which is incredible considering that science is not supposed to be an ideology. It's supposed to be a giant question mark.
It goes to show you that everyone accepted the ideology, even naturopathic societies, other societies that you think would question this. I mean, you can't even find Robert F. Kennedy in writing, like say in a major op-ed, questioning these vaccines ahead of time. I was able to find a Children's Health Defense webinar where people were generally questioning vaccines, and they said, yeah, we would have concerns about the COVID-19 vaccines, but no one kind of put it in writing to the House, the Senate, the White House. And boy, was I right. I mean, we had found out of the gate quickly. I testified in the Texas Senate by March of 2021. That's just 90 days into the campaign. We were seeing deaths reported. At that time, the CDC had told us 1,600 deaths in the vaccine event reporting system. That is an important system because doctors report to that system, and we only report the cases that we know the vaccine has caused the death. Because if we do any spurious reporting, it's subject to federal fines or imprisonment. And the doctor's name is an address and everything is about half of the entire reporting is who is the person reporting this. So we know the VAERS statistics are accurate and these are vaccine deaths.
Right. I mean, a lot of people say that the VAERS system is even underreporting for the reason that you stated, that if it's not provable beyond a shadow of a doubt, then people don't report it, or it's kind of a hassle to report, so they just don't report it sometimes. And it can be maybe even, I mean, there are some people that say it's by half the real number.
Well, it's 30-fold difference. So this is 1/30th of reality. And one of the major reasons why we can't report, like I saw patients yesterday with vaccine, heart damage, and blood clots in my office. I couldn't report their cases because they don't have their vaccine card. Now, many have actually lost their cards or don't have them anymore. I have to have the card to have what type of vaccine they took, when they took it, and the lot number.
Oh, my word. And so talk about your early protocol. You were also one of the first that was repurposing existing medications and saying, well, some of these things that we already have work to prevent severe COVID and even COVID fatalities. It's now known as the McCullough protocol because it's so effective. But there was a recent study that came out that vindicated you once again on hydroxychloroquine. Can you talk to us about that?
What people need to understand is that masks, lockdowns, and vaccines are not treatment. They don't substitute for treating a sick patient. So the pandemic response, if you read Scott Atlas's book about what went on in the White House with Trump, all they did was talk about lockdowns and social distancing and contagion control. There was no discussion of treatment. And then when the vaccines rolled out, it didn't matter. They didn't treat sick patients. Patients were getting sick. We had over 1,000 people dying a day. A vaccine doesn't treat that. And so we needed early treatment from the very beginning. McCullough protocol was the first published, widely utilized approach, very flexible, started out with nasal sprays and gargles. There's dozens of studies showing virucidal nasal sprays and gargles work. They even worked in the hospital to cut down the viral load. These were tremendous. Iodine-based and xylitol-based turned out to be the winners. Prospective, double-blind, randomized, placebo-controlled trials. Aspirin played a big role as a minor blood thinner. Hydroxychloroquine, you mentioned, supported over 400 studies. Huge one from France. I'm a co-author on with Dr. Didier Rialt. Nearly 40,000 people. Clear reductions in the risk of hospitalizations and deaths. As you pointed out, a recent study vindicated that. And by the way, fraudulent studies on hydroxychloroquine have now been withdrawn. And hydroxychloroquine was modestly effective. I think the big winner in the antivirals was ivermectin. Dozens of studies showed ivermectin at the right dose, had the most rapid effect in quelling the virus. We used Paxlovid when it came in, but it was slow to work. The CDC put a warning on it, said it extends the illness. It's not very impressive. Molnupiravir, the Merck drug, we used that too. I think monoclonal antibodies were a huge winner. We had 6 of them. Sadly, the U.S. government took them off the market one by one after a few weeks because of theoretical concerns that they would lose efficacy. And then finally, the steroids, blood thinners, colchicine. Colchicine, now widely used in vaccine injury syndromes. Colchicine is a drug we had used in gout. A network-wide meta-analysis showed about a 30% reduction with colchicine. When I had pulmonary COVID the first time, I took colchicine, and sadly, recent studies show only a fraction of high-risk Americans received McCullough protocol, and those who go on to be hospitalized and died is because they didn't get early treatment.
Which is tragic, since it was essentially available just about over the counter, or at least drugs that were very inexpensively manufactured, which is nuts to me. So you posted something interesting on your X account. And by the way, people are so hungry for this information that you're talking about. You have over 1 million followers on X now. I looked this morning, 1.1 million followers. It just shows you how many people are desperate for the truth in medicine because they're not getting it from anywhere else. You posted something interesting, I thought, about heavy metals being found in batches of the COVID vaccine. Can you talk to me about what's happening there and what the impacts of that are?
Metals, whether it's aluminum or mercury, have been used in vaccines at low levels to, in a sense, irritate the body and try to get more immunity. And there's concerns about this. In some vaccines, the aluminum and mercury has been removed, but they're still in others. For instance, the flu shot has aluminum in it. There's a concern that, once metals are in the body, they don't get out. So they accumulate. Now the COVID-19 vaccines, the most distressing thing about the vaccines is the issue of contaminants. So the Japanese have returned millions of doses of Pfizer and Moderna because of visible debris in the bottom of the vials. And now there's been discoveries of various crystalloid substances, probably cholesterol from the lipid nanoparticles, metal shavings, in now heavy metals in there. Especially the earlier batches look like they were far more dangerous than the later batches. And so this has been brought to the attention of the Japanese authorities, Canadian and U.S. authorities. Joe Ladapo has written the FDA and the CDC. He's the Surgeon General from Florida, saying, listen, they could be contaminated with fragments of DNA. And no government in the world, Liz, has opened the vials and done a chemical inspection for quality, purity, and safety of the products. No government in the world.
DNA fragments. I mean, what is the implication of that if that's happening?
It's scary. What's been discovered now, 4 studies have indicated SV40, simian virus 40, the origin of insertion, the promoter enhancer. These are known cancer-promoting DNA segments of DNA. They are found in the COVID-19 vaccines, found in both Pfizer and Moderna above levels of safety concern. So there should be an immediate inspection. All governments should be concerned about this. If people took the vaccines and then a cancer emerged later on, one would piece this together and say, oh my Lord, we were giving out contaminated vaccines. At least the public health officials would come to that revelation.
It seems crazy to me that that's not standard protocol. It's almost as crazy to me as the fact that there are no existing studies that directly compare the outcomes of unvaccinated children just with childhood vaccines versus vaccinated children. Seems like the most obvious thing that you would study to see if your vaccine is effective, and yet we have none. Same thing with this contamination issue. Seems like the most obvious thing. Where are we going to make sure that this actually is safe for people, that it doesn't have poison and dangerous particles in it? But no. What do you make of this? It seems to me that it's both an epidemic but relatively new spate of autoimmune disorders in our country, particularly among women. Is this correlated?
It is. Multiple papers show that the vaccines install the genetic code for the spike protein, which itself, incites an autoimmune attack, but also frame-shifted proteins. In a paper by Boros and colleagues, I'm a co-author. About a dozen additional unwanted proteins are produced from Pfizer and Moderna. Those proteins are inside cells, expressed on cell surfaces. The body immediately recognizes them as abnormal, and then there's an attack. It's so common that in my practice, I have to order blood tests to screen patients for autoimmunity. It is more common in women. An example is Megyn Kelly. She's a news anchor, and she's told former President Trump she has an autoimmune condition because she took a COVID-19 vaccine.
It's awful. It's awful. What about people who got the vaccine who are now afraid of whether it's myocarditis, whether it's autoimmunity? Is there anything that they can do to get this out of their body?
Again, I work diligently to try to fill an unmet need. People had a lot of regret they took the vaccines. And so after years of trying different combinations of products, we arrived at what's called McCullough protocol base spike detoxification. Nattokinase, which is a natural supplement derived from the fermentation of soy, bromelain, a family of enzymes derived from pineapple, and then curcumin in combination have good preclinical data in degrading the spike protein, which is stuck in the human body after vaccination and after the illness, as well as blocking some of the inflammation from the spike protein. And so, we've been deploying this now for 2 years, carefully observing people. I copyrighted in my name, so I tell you, I'm responsible if it doesn't work. And so I get feedback all the time on social media. Thank the Lord, people are getting better, slowly getting better. We see antibodies against the spike protein decline, so we know there is detoxification going. These are over-the-counter supplements taken in combination in between meals. The only caveat is bleedings. They are mild blood thinners, but most people need some blood thinning because the spike protein tilts the body towards coagulation.
I love that you put your name on it, by the way, because that's true accountability in medicine, something that I feel like our culture, at least since Ronald Reagan signed a law making vaccine manufacturers shielded from liability. We see very, very little of that. So I say that tongue in cheek, but I'm actually very appreciative of you. Now, everything you just described about the spike protein from the vaccine, does that also apply to the spike protein that's in the COVID virus? Or is it different in some way?
When we get the infection, and most everybody's had the infection, vaccinated or unvaccinated, we get what's called the S1 segment, the outer segment of the spike protein. So it's a little less than half of it, and it gets stuck inside white blood cells. But it's been described there for a year and a half or longer. So believe me, if you've had COVID, you probably have spike protein in your body. And we can detect this by persistent antibodies. With the vaccine, it's the full length spike protein, S1 and S2, and at much higher concentrations. So in our risk stratification publications, we say, listen, antibodies against the spike protein less than 1,000 are low risk. That's typically a patient who has just had COVID once or twice. But we see it above 1,000 arbitrary units, and it goes all the way up to 25,000 on the Roche Alexis LabCorp assay we use. That indicates the vaccine is continuing to produce spike protein in the human body. This is very disturbing. I testified in Congress earlier this year, and I told the panel, listen, we got 5 to 15 years of worry about the vaccinated. And we have probably 75 to 80% of Americans who took the vaccine. We are worried about them.
So the blood clot stuff that you see, I mean, I see it a lot on X, and you never know all the time what to believe on X or not. But you see these coroners saying we're seeing more blood clots in our examinations than we've ever seen before. If someone just has the spike protein from the quote unquote naturally occurring COVID virus as opposed to the vaccine, is that going to apply to them? Are they at risk of the blood clots of myocarditis, or is it just from the vaccine?
No. Well, for the blood clots, for sure, just with COVID alone, the infection, you can get a blood clots. I've seen in my practice, patient, gets COVID once or twice, have a blood clot going from the ankle to hip. That's just the respiratory infection. Goodness. Now you add in the vaccine, we're seeing massive blood clots going to the lungs, blood clots in the arms, right at the site where people take the vaccine injection. I've never seen so many blood clots in my life. We're using blood thinners at record rates right now. So for blood clots, both the infection and the vaccine can cause the blood clots. The spike protein is physically found in the blood clots, so it's thrombogenic. I think that's what the morticians are reporting, is just ubiquitous spike protein exposure, and they're just pulling out these huge clots ante-mortem, because once the blood flow ceases, the spike protein tilts the body towards coagulation. Normally the blood is liquefied, in the absence of spike protein. And before the pandemic, the morticians never had this problem. I think it's ubiquitous spike protein exposure. Now, for myocarditis, it's clear. There's a large study from the UK, open safely. The myocarditis, the heart inflammation and damage, only occurs with the vaccine, not with the infection.
And wait, what did you say? The protocol that you are now offering to get rid of the spike protein, what is that called? I've had COVID, I think 2 or 3 times. I haven't had the vaccine, but if that spike protein's in there, I got to get rid of that.
Yeah, I've tested it myself. I have it. I have COVID 3 times. I didn't take the vaccine, and my ears were ringing. That was my tip-off that, the spike protein's in my body. So it's nattokinase, 2,000 units twice a day, bromelain, 500 milligrams a day, and curcumin, 500 milligrams twice a day. And that's the starting doses. If tolerated, we can double or even quadruple these. We now use these in addition to blood thinners for people with blood clots, because these actually help dissolve the blood clots. We just have a caveat to be watchful for bleeding. For breastfeeding patients and pregnant patients, one can refrain from using the nattokinase for a period of time and use the other detoxifiants. Wellness company, I advise them as the chief scientific officer. They have a kids spike detox, even down to age 4. That's has other agents that we think are useful. Most people should be on detoxification. The Japanese get credit for discovering this. Dr. Tanakawa, he was actually trying to find something that would neutralize the virus, which it does. So another advantage of being on detox is you're much less likely to get COVID.
Oh, interesting. Because I feel like we just got the wave of it. We hadn't had it in my house in about 2 years. The last time we'd had it was January of 2022, maybe. But we just got a wave of it. We just got a wave of it a week or 2 ago. So I'm interested in that. What do you think of this recent marriage between Make America Great Again and Make America Healthy Again? Is this going to have a good impact on not just the brokenness of our healthcare system, but the corruption that underlies it?
Robert F. Kennedy coming over to Team Trump, I think, was a significant development. He's broadened this, remember, he's worked very hard in terms of environmental concerns like glyphosates and the accelerating vaccine schedule in children. But he's broadened it to including a diet, a quality of food, water, air. And I think it is a reasonable approach. The vaccines, basically, it's like a religious belief. And if you confront somebody on the religious belief, around the time of an election, people are going to start to react badly, particularly those who really have this religious trust in vaccines. They believe it's like a talisman. And so I think what they've done intentionally is just lay off the vaccines, understand that we have lots of ways to improve the health in America. We need a new HHS secretary and the assistant secretary, because it's not just vaccines and corruption, but think about the transgender disaster that's going on right now and being promoted by HHS. Think about the corruption in the CDC, the NIH, and FDA. We're looking at a major house cleaning and a change in philosophy oriented towards patient safety and freedom of choice, medical freedom of choice, free of mandates and other types of constraints that have really made us uncomfortable in recent years.
Yeah, there was a recent study just from last week, or a recent survey that said that trust in the medical system has fallen from 80% to 40%.
Yeah.
Which is incredible if you think about, and I know that the plural of anecdote is not data, but in my own experience as a mom of young children, I can tell you almost every one of my friends who were not quote unquote anti-vax to begin with, since COVID have, spoken to me, texted me, called me, talked about, said, listen, I don't want to give my children the vaccines at the CDC recommended schedule because I see what's happening. There is an awakening that's happening, Dr. McCullough, like nothing I've ever experienced. If you and I were to have had this conversation 5 years ago, we would have been branded worse than RFK was branded. We would have been like dangerous anti-vaxxers. Now, almost every mom I know feels that way.
There's always been about 2.5% of the population that took no vaccines over many decades, and they're perfectly fine, including the Amish. This is important. 5 studies show if people take no vaccines whatsoever, they're perfectly fine, because largely the infectious disease threats have been handled by water purification, better living standards, nutrition, diet, people living with clean bed sheets, etc. So they don't have the legacy diseases to worry about anymore. So, going unvaccinated is a perfectly healthy approach for children. And the World Council for Health now, as of 2023, advises that, particularly since the COVID-19 vaccines have been added to the schedule. We don't have any safety studies of giving vaccines in combination. At around year 1, I've counted it up, it's 16 different vaccines given potentially at one time at around age 1 year. Now they're in combination products, but many have had concerns. It's too much for children. Sudden infant death syndrome is linked to these big batteries of vaccines, febrile seizures, and then the development of neurodegenerative disorders. I think it's too much. Many parents are saying, you know what, I'm gonna take a more careful approach, safety first.
And that might be the silver lining of the COVID quote unquote pandemic, is that people's eyes are open. Dr. Peter McCullough, thank you so much for being on the show. I really appreciate it.
Thank you.